Welcome back to the Rick Smith Show. Now, here is Rick Smith.
So some good news. The NFL has opened up I guess they're going to open up all of the NFL stadiums across the country so that we can get medical personnel in there to give out the vaccines. Because guess what? Something probably we should have been planning on already. But to get people out, get the shots in people's arms, maybe even call out the National Guard to start doing some of it. Look, when I was 10 years old giving my grandmother shots for diabetes, and if a 10-year-old can wield a needle, I think we can train a lot of people to do this and get to that 1.5 million doses per day. Now, yesterday, you may remember, we were talking about the good old Ohio legislature and their SB 22, where the Republicans brought in, expert witnesses, tons of expert witnesses to share their hardships. There was the one woman who couldn't get the organic cheese for her cheesy bread. There was the guy who, evidently the mask caused his divorce. The kid who couldn't throw the dodgeball because of the hand sanitizer. Experts for expert testimony. No, seriously, it's crazy, but this is who they brought out. And I didn't actually see an expert, unless you consider the legislators there, who were completely maskless. If you want to consider them experts, I consider doctors experts. I consider the people who have spent their lives studying this stuff and know a whole lot more than I will. I go after them. And that's why I reached out to a real expert. You may remember I talked about this thread back in November of this doctor who said that there was a guy coming in with Nazi tattoos into the ER, on oxygen, just basically holding on for his life. And, it almost started off like a bad joke. A Jewish doctor, a black nurse, and an Asian respiratory therapist, and a Nazi. And I'm going, I don't know that I could have been as good as these people and as professional as they are. But that's why I've asked a good doctor to come talk to us. Taylor Nichols, MD, emergency room physician, and, got to be honest, a guy with a soul. Dr. Nichols, thanks for taking time for us.
Thanks so much for having me, Rick.
I got to tell you, when I first read your thread, and we're going to tweet it out again to make sure everyone gets a look at it. But, I'm sitting here trying to put myself in your position, in the nurse's position, to see this Nazi coming in, the guy with the tattoos, and somebody who hates you on every vein, begging for your help to save their life, and for you to not just walk away from him. I don't know how you do that.
Yeah, it's not that uncommon, unfortunately, to have patients who don't respect us, don't value us, or don't treat us well necessarily, particularly in the emergency department. But I'd say this particular incident it just highlighted that discrepancy between the compassion that we try to hold for all of our patients and the compassion that's given to us, or the value that's placed on our lives versus theirs, in the midst of, this pandemic, as you were talking about earlier, where people just don't even want to believe in us. They don't want to value us and what we're facing in trying to help them.
When this pandemic first happened, I went to my doctor because I forget what it was, but I had an appointment that I had to go to, and I asked him about it because we didn't know much at the time, and he said, look, he goes, we don't know everything about this, but what I'm telling you is follow the directions, wear the mask, wash your hands, stay away from people, and do smart stuff. He goes, we don't know yet. It could be nothing. It could be something. He said, but you know what? 6 months after they say it's okay to stop wearing a mask, who's going to keep doing it? He said, me, because I understand this stuff. And this is where, the other day when Jen Psaki was being attacked for saying, after we vaccinate everyone, we still have to do this stuff for a period of time. This is what my doctor told me almost a year ago.
Your doctor was spot on. And honestly, I was just having this discussion with some of my colleagues just yesterday even, talking about how crazy it is to think that a year ago we were intubating patients without masks on. To think that we were getting, every year I got sick. Every year, you're examining kids, for example, and you got to look in the back of their throat, and you get up in their face and you're putting the tongue depressor in their mouth, and they gag or they cough or they're screaming at you. And every year, inevitably, you got sick. This is the first year that I've been in medicine that I haven't gotten sick at all. And part of that is because we're wearing masks and we're asking our patients to take precautions too. So if they're coughing and they have a mask on, we're protected from that.
No, and this is the thing that,
and we're protected by the masks that we're wearing and the face shields that we're wearing too. And so your doctor was spot on. That's exactly right. I don't think I'll ever give up wearing a mask in my practice now.
And this is something that we've talked about. Is this the new normal going forward? And, I go back to a story of over the summer where we went, way up north in Pennsylvania, and I was wearing a mask in a store, and the woman was mocking me. She's like, "What?" I go, "Do you have any idea where I've been?" I said, I'm wearing this mask not to protect myself, but to protect you, because I'm considerate of others. This is where I think we've lost some of this, because you're right. People come into you sometimes in their worst moments, and you take care of them, whether they've got Nazi tattoos or not. I think that's something that we should really respect and honor.
I appreciate that. I think you hit on something that's really important there, Rick, which is we've forgotten why we're even wearing masks, right? Your point is well said. We're wearing masks to protect other people because they don't know where we've been and we don't know where they've been. It's an exercise in compassion. And really, that's the hardest thing about it to me. The fact that we have to have a fight over this, that it's had to become so political about just doing something simple to protect other people, to just express that compassion to others, to say, I know you don't know where I've been. I know, that I don't know where you've been. Like, this is something that is simple to do to protect me and for me to protect you, just wearing a mask, keeping a distance. And so having to fight about that is so frustrating and disheartening, especially as a physician, when we've seen what happens. We've seen what what people are actually experiencing when they do get sick.
Yeah. So let me ask you about the guy that wheeled in with the Nazi tattoos and all that. Because if I'm you and I'm standing there, my first thought is, I know this guy was doing nothing to protect himself. I know he was probably out there being as reckless as he could be, and he probably infected a whole bunch of other people. And my mind goes to this spot. You're getting exactly what you deserve. And I know I'm vindictive and vengeful, and I'm going to burn in a place that I don't want to go to. But that's where my mind goes when I see this. And I'm curious, what happened to this gentleman? I know you guys, did all of the things. You went through the thread, and I hope people will read it. You guys did everything you could do. What eventually happened to the guy?
I actually never. It was a really busy night in the emergency department. It was overnight, and I never had a chance to follow up on him. I know, we intubated him. I know we went up to the ICU. I know my colleagues took incredible care of him. I imagine he did okay, but I'm sure he was sick because we watched him decompensate rapidly in the emergency department. And I understand your sentiment. It's hard not to think through those thoughts, but being on the other side of the bed from the patient and standing there as a physician and as the nurse and as the respiratory therapist, we committed ourselves in our training to not judge and to just be there to take care of people. And so as much as one might think, like, how could you do this? It's just, this is what we're there for. And we will be there. Our doors will always be open. And we'll be there to take care of anyone, regardless of who they are. That's sort of the mantra of emergency medicine is anyone, anytime, anywhere. Is come through our doors and we'll take care of you, regardless of who you are.
Right. Even if you're a Nazi.
Or what you believe.
Yeah, even if you're a Nazi. And look, I'm not condemning you. I hope you don't take it that way. I'm actually honoring you and saying that you're a much better person than I could ever want to be, because I would have to be that judgmental. There was a lot of us when Herman Cain passed who were going, well, what did you expect? And I wasn't happy. I wasn't, I didn't, there was no glee. It's a sad, horrible situation, but it is what it is.
Yeah, I can understand. I can understand that sentiment.
Yeah,
certainly.
So let me ask you this, because we hear these horrible stories, and there's just been so many of them. And I see these stories of nurses wearing garbage bags and having to reuse masks, and we don't have enough ventilators or PPE, and there's all of these stories. Have things gotten better in your view over the last several months? Are we heading in the right direction? Because I want to believe that come summertime, we might be somewhere back to normal. I'm curious how you're seeing things.
From my end, at least, and I can only really speak from, I'm in Northern California. I can only speak from the perspective of my experiences and those of my colleagues who I've spoken with, but things are getting better. Supply chains, the initial crush of not having supplies, the supply chains being sort of blocked up, improved. We have more supplies, certainly not everyone. And there are still places where there isn't enough PPE or personal protective equipment. We do still have limited supplies because we go through it so quickly. We probably have as much as we always did before. The difference is that we're using it so much more rapidly. But it exists. It's there. I certainly feel safe in my emergency department, and I know my colleagues nearby do as well. But that said, if this were to go on for a significantly long period of time, I think there would still be a strain. But I think we're in a better place than we were before.
Okay, I'm glad to hear that. One of my big concerns, and I've talked with other doctors over the last several months, is that once we do get to the other side of this, good folks like you are going to burn out, and that we're going to lose a significant number of doctors and nurses and healthcare professionals because of our own stupidity, of poor planning, of poor execution, and of people just being burnt out. Do you share that that common thought? Do you think we're going to get through this? And I'm curious how you see things down the road.
Absolutely. That's one of my greatest fears, honestly. We were facing physician shortages across almost every specialty, if not every specialty, before this started. And so if we're to lose people from every specialty, that shortage is going to be significant. I mean, doctors, nurses, et cetera, you name it, every position in the hospital, there's always a need across the country. And if we're to lose good folks from the bedside, that's going to be a problem. That's one of my biggest fears. I mean, there's definitely going to be burnout or PTSD from this, and there's no way around that. I think we really need to ramp up our efforts as we start to wind down the pandemic. We need to ramp up our efforts in terms of support and making sure we have a good focus on mental health and making sure everybody is okay and that we can keep people in medicine who do want to stay.
Right.
I can speak for myself, at least. I want to stay. I love this job. It's been difficult. It's been hard to see, as you've mentioned, that society hasn't treated this as seriously as I would have hoped. But I'll be sticking around, and I really hope that I can be there for my colleagues to make sure that they stick around as well.
Yeah, because we know, like I said, I've heard just some horror stories, and being under the constant stress that you guys are under, and the constant cloud of, it just seems, it's got to seem almost insurmountable when every day the numbers keep going up. We're over 450,000 dead now. I hope we're coming over the peak. But still, the death numbers are still way up, more than they were at the beginning of this. And it doesn't seem like anybody's taking it serious at all. So I guess I'm curious, what do you want from people, if people out there listening, what's the message for them?
I think my biggest ask would be for folks to reach into the same sort of well of compassion that they have for their neighbors, as those of us on the front lines are extending to everyone who comes through our doors. And that means doing your part for preventative measures, like wearing a mask and keeping a distance. That means getting vaccinated when your turn comes up. The relief of having now had my second dose of the vaccine is huge. Knowing that I won't bring this home to my family and my community has been a huge weight lifted off my shoulders. And I really, really hope that as more people understand that this vaccine is safe, it's effective, or all the vaccines that are out right now, whichever one comes up, take it, because that's the way we're going to wind this down. And that's the way you're going to be able to express your compassion towards your community and towards this country, because that's how we're going to get through this. And one day, hopefully, as we ramp the vaccination up, we'll wind this process down.
Yeah. Let me ask you.
For now, keep digging in.
Yeah. No, I mean, I'm right there with you, but I'm looking at these variants that are coming around that maybe the vaccine's good for, maybe they're not. And as I've had it explained to me, the fact that we've let this rage the way it has caused it to mutate and more of these variants that could make it happen longer. So is it possible that, with a vaccine, and if you are exposed to it, we could end up being, because I know some people are, I'm going to get the vaccine and I'm Superman. What I'm trying to get to is once you get the vaccine, you still got to do some of the sane stuff, right?
Absolutely. Absolutely. That's an excellent point. Thanks for bringing that up. So when you're vaccinated, still important now that we know that, yes, the vaccines so far have proven to be effective against the variants that we know to exist here, but we still need to use precautions appropriately. And so once you're vaccinated, make sure you're still wearing a mask, make sure you're still keeping a distance, wash your hands, all the same things. Yes. Is it beneficial? Yes. Does it give you immunity against what we currently know? Sure. But we want to be sure that we can wind this down. And that means taking the appropriate steps to avoid outbreaks of other variants.
Yeah. It comes down to that little thing of, I know we love to say we're a Christian country, but we don't seem to act like it. That whole love thy neighbor thing, maybe we should be doing that. Which the weird thing is a lot of my evangelical friends are the anti-mask crowd, which is just twisted to me. But I hope we get through it. And with good folks like you on the front lines, I think we got a shot. And Dr. Nichols, I appreciate the work that you do. I appreciate you taking some time for us, and good on you, sir.
Absolutely. Thank you so much, Rick. Thanks for having me, and stay well.
Good stuff. Seriously, I don't know how folks do this. I don't. But God bless them, and thankfully that they do. I'd love to hear your thoughts. You can email me, rick@thericksmithshow.com. I'm going to take a quick break. Right back. Stick around. You're listening to The Rick Smith Show.
Remembering that united we bargain, divided we beg. Rick Smith.